Good morning, everybody. Oh, I think we're on the afternoon. Nice to meet you all. My name is Zaf Smith. I'm going to be talking about virtually the trying to reason with a robot. So I'm an emergency physician, as Craig mentioned, working in Townsville Hospital. I'm also the head of clinical studies with James Cook University, so I help support the 4th, 5th, and 6th year medical students. This is my AI-enhanced mannequin called Chad, and we'll meet her a bit shortly. Alright, we're just going to start with this picture. Does anybody know who this man is? He's got some nice sideburns. He's got a typewriter that he's typing on. Yes, I heard something.
Hans Christian Andersen.
Hans Christian Andersen, the famous storyteller. Look, it's not Hans, but he is an author. Anybody else want to try? Who is this man?
Alexander Fleming.
Alexander Fleming, the inventor of penicillin. Also not quite right, but he is a professor of biochemistry from Boston University. Anybody else?
Isaac Asimov.
Yes, Isaac Asimov. This is Isaac Asimov. Now, you may not know who Isaac Asimov is, but you've definitely heard of something he wrote about in 1939, the 3 laws of robotics. So the first law is robots shall do no harm to humans. The second law is robots shall obey, yes sir, anything a human says, unless it contradicts the first law. So you can't tell a robot to kill somebody else on your behalf. The third law of robotics is that robots should protect themselves, unless, again, if that contradicts laws 1 and 2. Now, some writers have proposed that there should be a 4th law of robotics, and that is that robots should augment, not replace humans, and that robots should collaborate and be part of teaching humans how to be better, in this case, clinicians. So you can see this robot and this man holding hands and teaching each other how to handle something. Alright, there's a specific type of human that I'm particularly interested in, our medical student humans. So let's ask this question. So how can robots augment and teach our medical students how to be better clinicians? This is from Crosscarry, 2009. Claire actually referenced this, the idea of type 1 and type 2 processing in the process of clinical reasoning. So a patient comes in with a presenting problem, just say abdominal pain. You, as a clinician, might recognize the patterns of their signs and symptoms, or you might not recognize it. And so you go down this either type 1 or type 2 processing. I'm not going to explain that in too much detail, but then you punch in some numbers, things go through your brain, and you come up with a diagnosis. So how can we teach this fairly complex process of clinical reasoning to our young medical students? Well, let's ask ourselves, how did we learn clinical reasoning? We talked to lots of real patients. We made lots of mistakes. We received lots of feedback, sometimes harsh feedback from our supervisors, and we observed others taking histories, examining patients on ward rounds and in clinics. So with real patients, the benefits are, it's the real deal. It's what we're trained for. We, as medical students, can experience the full range of human emotions because it's a real human you're talking to. But real patients can get tired. There's a limited number of patients in your clinic on your ward round. It's not a standardized interaction, and it can be variable, the feedback that's given to the students or the junior doctors who are taking the history. So this is what we do in real life, is we use other role players, and in this diagram we have a medical student role-playing a patient to another medical student. The benefits of this approach is that it's a more standardized interaction. We can give a pre-planned script to the role player, and we can give some binary feedback. Ooh, you failed on that diagnosis, or you've passed on this one. But again, role players and actors can also get tired. It can be a variable standard of acting. We all know that role player who gave way too much information, or who was really tight and just didn't say anything. It can be a variable quality of feedback that's given to the students, and it can be costly if you're paying for tutors, paying for actors. Alright, so why don't we try using AI chatbots as patients? And that's the big question. So I might hear you asking, so what exactly is an AI chatbot, Zach? Well, it's a computer program that uses artificial intelligence, specifically natural language processing, NLP, and machine learning to simulate human conversation. So chatbots are specialized programs that imitate human language and conversation. Alright, so some of the benefits are, similar to a role player, a human role player, is a chatbot can have a standardized interaction, you can provide it with a pre-planned script, you can give a pass-fail feedback, but this is where I think the strength lies. Chatbots are repeatable. You can have 1,000 students talking to the same chatbot and it will never get tired. It's also scalable, so you can have one student and have 1,000 different patients within this chatbot algorithm. It's accessible, so students can access these chatbots on their phone, at the coffee shop, on the couch, while watching Netflix and listening to podcasts and doing the AI function at the same time. You're not restricted to the classroom or the ward round or the hospital. Improvisation. AI chatbots are very creative and can, as we said, hallucinate and kind of make up stuff. But in the sense of being a role player, that's actually a strength. So if you ask a chatbot a question that doesn't fit the script that they've been given, they will very happily make up some other random thing. But I believe it can still be conducive to the role-playing experience. Feedback, again, this is actually quite a strength, where AI chatbots can give quite specific, quite constructive, quite kind, empathetic feedback to a student and not make them cry, not make them humiliated, and not make them feel bad about themselves. Because that's what this program is trained to be, kind, make them feel happy about themselves. And the feedback can be timely. Alright, enough chit-chat. I'm going to do 2 demonstrations of a live chatbot. The first chatbot I'm going to share is an experiment that 2 medical students and I have worked on for the last 12 months. This is Thomas, who did all the coding himself, and Luca was the creative aspect that helped me with the flow of this program. So this is the program we've created, and I'm going to show you this now. It's called the EPIC Virtual ED. It stands for Emergency Physicians in Important Cases, Virtual ED. It's a high-quality, interactive, web-based, AI-enhanced digital medical education platform that simulates an emergency department to enhance the learning experience of medical students. Now, while you're watching this demonstration, just have in mind 3 things. How realistic this chatbot is, how human-like it is. Be aware of the improvisation that the chatbot will demonstrate, and then reflect on the feedback that the chatbot gives me as a medical student taking the history. You guys ready? Okay, let's hope the computer is beautiful. Okay, so this is the EPIC Virtual ED. It starts with a fishbowl in the middle, and you have resus at the front, and then cubicle beds going around the side. So the students can click on each of these rooms. Let's try bedroom 1. It says, patient 1, 27-year-old female, stay-at-home mother with abdominal pain. So let's see the patient. Now, the app has history, exam, investigations management. For this presentation, I'm just going to show you the history part. So you click on history. Now, there's a couple of options. The first option I'm going to show you is the video role play. So this is the human role play. You click on interview, and it loads a little video clip of
I'm a 27-year-old female. Started her mother. I've had this really bad abdominal pain. It started 2 days ago, and now it's a little. Help me. My last period was 8 days ago, and I have an ovarian cyst on my left side previously. I haven't had any STIs. My husband and kids get really worried. I need your help. Oh.
Okay, so you can see variable standard of acting quality, but this is this is a third-year student called Kai, and he's role-playing for his other third-year colleagues. Now, this is where it gets interesting. So it's the same script, but we've loaded it into an AI chatbot function, and again, it's still Ruby, 27-year-old female with abdominal pain, but now, It just takes a few seconds to load. And what you'll see is when it starts, it's taking my language, my text, or my voice, converting it into text, and then analyzing that text. All right, here we go. Hi, Ruby. It's Zaf here, one of the doctors. Can you tell me what's brought you in today? So you just have to click start talking and then stop talking. And because this is being homemade by 2 medical students and myself, there's a little bit of a delay. We're using the free app. You know, it's
Hi
done.
Isaac, I'm Ruby, 27, a state of one. I'm calling because I had about 2 days of increasing pain in my right lower tummy. It started gradually as dull, then earlier today it suddenly got really severe. It's worse when I move around, and I've been feeling quite nauseous with it.
Okay, thanks, Ruby. Can you be more specific and describe the exact nature of the abdominal pain you've got? Okay, so while it's loading, you can see it responded with quite a robotic voice. It was a little bit monotone. The amount of information might be a little bit more than what you'd expect from a real patient. I'm basically stalling modes. Any time now.
It's low on the right side, just above my groin, and feels deep inside the pelvis. It started 2 days ago as dull, crampy ache like a bad period pain, then a few hours ago it suddenly became a sharp, stabbing, tearing pain that took my breath away. Since then it's been there constantly with waves where it breaks harder. It spreads across my lower tummy to the middle and into my right hip and lower back. When it's really bad I get an ache up under my right ribs and into the tip of my right shoulder. Moving makes it much worse.
Okay, so she's talking a
turning in
lot.
bed, coughing, even bumps in the car. Lying very still with my knees up helps a little, paracetamol hasn't helped. It's about 8-9 out of 10 at its worst. I feel quite nauseous with it and a bit lightheaded when I stand.
Okay, thanks, Ruby. Can you tell me what your favorite burger is to get from McDonald's? So with that question, I didn't tell it, that's not in the script that I'm given, but I'm curious to see how it hallucinates or improvises on that kind of question. And you can see the text that it's given. Again, I probably reprogram it so it doesn't give a whole brain dump of everything all in one go, because that's probably not as realistic as what you get.
No problem. Paracetamol hasn't helped. It gets to about 8-9 out of 10, and I feel quite nauseous and lightheaded when I stand. I'm starting to feel a bit faint. Can I lie down, please? Is there anything else you'd like to ask?
Okay, so didn't even answer my McDonald's question. I was like, what? Anyway, so you can see how it's not perfect and it has some things to work on. Now, you can click End Consult, and this is where it comes up with, what is your provisional diagnosis? So what do you guys reckon? 27-year-old female with abdominal pain, why don't we say testicular torsion? Okay, so this is where I think this particular program has its strength, is it takes the questions that I've asked, it takes the diagnosis that I've given, and then it gives me specific feedback about the questions and the diagnosis I've given compared to what the actual diagnosis is. So it's just kind of moving along. Here we go. Okay, so this is the feedback, and again, this is AI generated. I have not told this what to say. Good thinking to consider a surgical cause, but this was not testicular torsion. It's a ruptured ectopic pregnancy. Key discriminating factors, patient factors. Torsion occurs in males. Ectopic is in any woman of reproductive age. All right, I will remember that for the next time when I take my history. Testicular, remember, tender hemiscrotum. Questions to ask next time. Sex and pregnancy screening for all reproductive age patients, blah, blah, blah. ED next steps, blah, blah, blah. So, again, it's giving me feedback on my mistake of saying a torsion and linking it to the actual diagnosis, which was an ectopic pregnancy. All right, let us move on. So that was that. Let me bring us back to here. Are we back up? Yeah. So let's debrief on that experience. Was it realistic? Look, a bit robotic, a bit clunky. We've all got better things to do than wait 20 seconds for it to think about what it wants to say. Improvisation, pretty pathetic. I think it didn't answer my burger question, didn't hear what I said. The feedback, I think, was quite good, the way it picked it up. Okay, I need a second demo. Can I get a live volunteer, please? Anybody, anybody, anybody? Yes, thank you. Come on up. Please have a seat. Okay, I'd like to introduce you to Chatty. Chatty is sitting here. Now, Chatty, I've got a live volunteer here. Her name is Shana? Shannon. So, Chatty, is it okay if you role play being a patient and Shannon will pretend to be a medical student taking a history? Would that be okay, Chatty?
Absolutely, I'd be happy to do that. Hello Shannon, nice to meet you. Whenever you're ready, we can start the role play. Just let me know what kind of patient or scenario you'd like today.
Okay, Chatty, just before we start, remember the cases that I uploaded to you earlier? Can we do the case of abdominal pain, the case about Ruby, the 27-year-old? Would that be okay if you role play that one for Shannon?
Yes, of course, we can do that. I'll be Ruby, the 27-year-old with abdominal pain. Shannon, feel free to start whenever you're ready and ask me any questions about my symptoms.
Hi Teddy, nice to meet you. I'm one of the doctors. Could you tell me a bit more about what you're doing today?
Hi Shannon, nice to meet you too. Yeah, I've had this really bad pain in my lower abdomen since yesterday morning and it's just not getting better.
Can you tell me more about what it feels like?
It started pretty suddenly around 8 a.m. yesterday and it's been constant since then, not really going away.
What did you buy from Aldi last week?
What did you buy from Aldi last week?
That's a fun question. I bought some fresh veggies, some pasta and a block of chocolate. Can't resist that.
That's great. Can I ask, what is your favourite burrito from Zambro's?
Ooh, I love Zambro's. My favourite burrito would have to be the classic chicken burrito with black rice and lots of guacamole.
Very nice, but I can't understand what you're saying. Can you please speak with a French accent?
Ah, bien sûr. Je peux parler avec un accent français. Est-ce que ça vous convient comme ça?
Excellent. Shannon, could you share with Ruby what you think the diagnosis is?
Ruby, I think you're just
Oui.
really hungry today. You're suffering from hunger pains.
Ah oui, je comprends. Parfois ça peut arriver. On peut se sentir un peu affamé en pensant à toutes ces bonnes choses à manger.
Okay, so Chatty, we're just going to end that scenario now. Shannon feels that your diagnosis was hunger pains, because I think we're all getting hungry for lunch in this room. But Chatty, what was the actual diagnosis? And can you give some feedback, say 300 words feedback specific for Shannon to improve on?
Sure. The actual diagnosis for Ruby in this case was appendicitis. Shannon, you did a great job at making me feel comfortable and asking about when the pain started and its details. One area to improve could be to ask more about associated symptoms, like whether I had any nausea, fever, or changes in bowel habits. That can help narrow down the causes of abdominal pain. You could also ask about any previous similar episodes or if there's any pain when moving around. I liked how you showed empathy, especially when I mentioned the pain was constant. Keep that up. One thing you might want to focus on is summarising what I've said so far to show that you're listening and making sure you've got the full picture. That can help with clinical reasoning. Overall, well done. Just dig a bit deeper into those associated symptoms and past history, and you'll get even better.
Thank you, Chatty, for that very specific feedback. Chatty, can we give Shannon and the audience, can we give Shannon a round of applause for volunteering?
Well done. That was fantastic.
Okay, Chatty, I'm going to let you head off to lunch. I'm just going to press stop there. Thank you. Goodbye. All right, thanks our volunteer. Okay, so debrief. What did you guys think about the realism of Chatty? How realistic? It was pretty impressive, wasn't it? A sense of humor, changing tone in the voice, had a little chuckle when we asked the Aldi question. Improvisation, I mean that Aldi question, she just walked right over it. The Zambro's too easy. She could even speak in a different language. In terms of feedback, it was quite kind, she was very encouraging, quite specific feedback from the way Shannon had asked her questions. So, this is a face reveal. Who was Chatty really? This was completely free, ChatGPT version 5. Everybody in this room can access this function for free, available. You literally open ChatGPT, you can do it right now at lunchtime, and there's a little button which I had never heard of before until my medical student told me. 3 weeks ago. And you click this button and it'll open up an AI chatbot that accesses the entire ChatGPT database. So let's wrap up a little bit here. So in terms of a recorded human actor, you know, Kai was very entertaining, very realistic, but he didn't give any feedback specific to the student history. My virtual ED app, very clunky, robotic voice, but I feel like this feedback was actually not too bad. ChatGPT, smooth voice, excellent improvisation, quite entertaining. The feedback, I mean, I put generic, but that version of the conversation I thought was quite good. The next steps, I would love to put ChatGPT robot's head into my Epic virtual ED, but as I said, it's 2 medical students and a lonely lecturer trying to create this out from scratch. We need funding and more input. I might need to talk to Rudolph then in the future. So that's the next step. So take-home messages, AI chatbots can be used as simulated patients. Look, we are never going to replace human patients, but this is something that could augment a medical student learning. The benefits are it's repeatable, scalable, you can have 1,000 unlimited patients, it's accessible. Improvisation can be its strength. Hallucinations is its strength, not its weakness in this teaching scenario. Feedback can be specific. Technology is free and capable, but again, still more experimentation and tweaking needed. Let's hope we can live up to the 4th law of robotics, where we have robots augmenting us, lifting us up, and not replacing us as humans. Thank you.